What is gonococcal arthritis? These are the signs you could have it. Yes, it's possible to get a form of arthritis from a sexually transmitted infection. Please like, share, comment and subscribe this video.
Click on Zombie Apocalypse.
Rates of gonorrhea, a bacterial sexually transmitted infection, are rising dramatically in the United States. They increased by 18.6% from 2016 to 2017, according to the Centers for Disease Control and Prevention. While you might think of the sexually transmitted infection as causing symptoms like painful urination or vaginal penile discharge, gonorrhea can also spread beyond the genitals, rectum, and throat. In some cases, the Neisseria gonorrhoeae bacteria can travel throughout the body in what's known as disseminated gonococcal infection (DGI). One of the main areas the bacteria like to settle in is the joints, which results in a condition known as gonococcal arthritis. Gonococcal arthritis is a type of septic arthritis, which means that the joint symptoms are caused by an infection in the joint. Symptoms of gonococcal arthritis. Someone with gonococcal arthritis might experience gonorrhea symptoms, such as pain when urinating or noticing discharge, but most women and about half of men will never experience those genital symptoms. They might not realize they have an STI until the DGI symptoms appear. Gonococcal arthritis normally affects 1 to 4 joints, most commonly large joints like the knees, wrists, or ankles, says Jean Marazzo, MD, director of the Infectious Diseases Division of University of Alabama at Birmingham School of Medicine. Pustules on the palms are another telltale sign of gonococcal arthritis, adds Chris Morris, MD, a rheumatologist with Arthritis Associates in Kingsport, Tennessee. Gonococcal arthritis could also be accompanied by fever, rash, or painful, inflamed tendons in the wrist. Causes of gonococcal arthritis. Gonococcal arthritis starts when Neisseria gonorrhoeae are passed through vaginal, anal, or oral sex. In about 0.5 to 3% of those cases, the bacteria spread beyond the initial infection site through the blood and infect other areas of the body. The bacteria like to focus on the joint, where they gets in there and grow, says Dr. Morris. Some people are more at risk for disseminated infection than others. For instance, HIV and certain arthritis medications can suppress the immune system, leaving patients more at risk for the bacteria to spread from the initial infection site, says Dr. Morris. Women are also more likely to develop gonococcal arthritis than men, and not just because of their initial risk for gonorrhea. For men, the only place bacteria can go is in the testes, says Dr. Marazzo. But women have an entire upper reproductive tract to start establishing an infection up there. Gonococcal arthritis versus non-gonococcal septic arthritis. Gonococcal arthritis shares some similarities with non-gonococcal septic arthritis. Both normally affect few joints, often the knees or ankles. Here are a couple of key differences. Although both can be seen at any age, gonococcal arthritis is most common in people under age 40, while older people are at a higher risk for other types of septic arthritis, like those caused by staphylococci, streptococci, or fungal or viral infections. Inflammation of the sheath around a tendon, tenosynovitis, shows up in gonococcal arthritis but not other types of septic arthritis, and fever would also be rare in non-gonococcal septic arthritis. How gonococcal arthritis is diagnosed. It's always a good idea when you see people with musculoskeletal complaints, to take a sexual history, says Dr. Marazzo. Especially in young people, but we don't want to assume older people aren't also at risk. To diagnose gonococcal arthritis, doctors will search for signs of gonorrhea through various tests. They could take joint fluid or urine samples, or swabs from the throat, vagina, or penis. In those samples, doctors will use a culture test or a gram stain, both of which can show evidence of the bacteria. Anyone who's been diagnosed with gonorrhea or gonococcal arthritis should let their sexual partners know so that they can be tested for gonorrhea too. How gonococcal arthritis is treated. Treatment for gonococcal arthritis is the same as for the sexually transmitted infection gonorrhea, antibiotics. The CDC recommends taking ceftriaxone intramuscularly or through IV once a day, plus an oral dose of azithromycin. Usually it's really responsive, says Dr. Marazzo. People will feel better within 24 hours. Ankylosing spondylitis, what is it, and how is it treated? If you have chronic back pain that developed in early adulthood, wakes you up at night, and feels better with movement and worse with rest, listen up. When you're dealing with back pain that won't go away, your mind probably jumps to causes like overuse or age-related wear and tear. But in some cases, joint pain in the spine comes from a form of inflammatory arthritis like ankylosing spondylitis, as is the most common condition under an umbrella term of spondyloarthritis, a group of inflammatory diseases that affect the spine as a hallmark symptom. Other kinds of spondyloarthritis include psoriatic arthritis and reactive arthritis. Symptoms of ankylosing spondylitis. Back pain is the hallmark sign of but unlike pain from mechanical back problems, with inflammatory back pain, symptoms tends to get better with movement. Ankylosing spondylitis pain tends to be at its worst at night and early in the morning. Says Bharat Kumar, MD, Associate Rheumatology Fellowship Program Director in the Division of Immunology at the University of Iowa Hospitals and Clinics. The proposed reason is because when you're still or at rest, there's a lot of swelling and water that goes to the joints, and that can cause inflammation, he says. When you start to move around, the water gets pushed out, and the swelling is decreased. Here are other differences between mechanical and inflammatory back pain to pay attention to. In classic AS cases, the pain, swelling, and inflammation starts in the sacroiliac joints, where your spine and pelvis connect, though it could also start farther up the spine, says Santa Fe rheumatologist Hilary Norton, MD, who has as herself. Ankylosing spondylitis can also involve joints beyond the spine, called peripheral joints, such as the shoulders, ribs, hips, and feet. As ankylosing spondylitis progresses, spinal joints can fuse together, giving patients less range of movement, though not necessarily more pain. Some patients also show non-joint-related symptoms, like eye redness and pain, known as uveitis, psoriasis, inflammatory bowel disease, and fatigue. Symptoms tend to develop in early adulthood, they usually appear before the age of 45. However, there's an average delay of 7 years between those first signs and getting an AS diagnosis, because AS can't be clinically diagnosed until it's progressed enough to see visible damage on an X-ray. Until then, it's known as non-radiographic axial spondyloarthritis. Causes of ankylosing spondylitis. Ankylosing spondylitis is an inflammatory disease, which means that the symptoms come from inflammation in the body rather than from natural wear and tear. Scientists don't know why the body starts producing chronic inflammation in people with AS, though genetics seem to play a role. Most people with ankylosing spondylitis have a gene called HLA-B27, though having the gene doesn't guarantee an AS diagnosis. About 80% of HLA-B27 carriers whose parents have AS will not develop the disease, according to the NIH. Other genes, IL-23R and ERAP1, have also been connected with ankylosing spondylitis. Men are also more likely to develop ankylosing spondylitis than women, however, the discrepancy is much less than previously thought. Women may actually be underdiagnosed with AS in part because it has a reputation as a man's disease, and therefore symptoms might be overlooked in women or misdiagnosed for something else. Men tend to have more radiographic damage, though women tend to have worse AS-related quality of life, according to a study in the journal Rheumatology. Read more about how AS affects women differently. Ankylosing spondylitis versus other types of spondyloarthritis. Ankylosing spondylitis shares a lot of overlap with other conditions under the spondyloarthritis umbrella, including psoriatic arthritis, enteropathic inflammatory bowel disease-related arthritis, and reactive arthritis. There's no strict line to differentiate one from the other, says Dr. Kumar. For instance, a patient might have psoriasis or IBD and still be considered to have AS, says Dr. Norton. Like other types of spondyloarthritis, symptoms typically include back pain, and a rheumatologist will take all symptoms and test results into account to pinpoint the diagnosis and treatment plan. Ankylosing spondylitis is considered to be a seronegative form of arthritis, which means that patients don't have the same biomarkers doctors would expect to see in people with rheumatoid arthritis, such as rheumatoid factor or anti-CCP. Diagnosing ankylosing spondylitis. There's no hard and fast test for AS, so rheumatologists need to consider symptoms and medical history, along with blood tests and imaging, to determine a diagnosis. A doctor will likely order blood work to test levels of inflammation and, in some cases, to check for the HLA-B27 gene. X-rays and MRIs are what really set us apart from its earlier stage, non-radiographic axial spondyloarthritis. It can take up to 10 years for any changes to show up on the X-ray, which is why diagnosis is so difficult, says Dr. Norton. Signs of the disease that could show up in the imaging results include sclerosis, bony thickening in the joints, joint erosion, new bone formation, and bamboo spine, backbones that have calcified and become rigid. Read more about how doctors diagnose ankylosing spondylitis here. Treatment of ankylosing spondylitis. There's no cure for AS, but there are ways to ease the symptoms and slow its progression. The official American College of Rheumatology as treatment recommendations include non-steroidal anti-inflammatory drugs (NSAIDs) as a first line of treatment. Though Dr. Norton points out that by the time most patients see a rheumatologist, they have tried those already. From there, rheumatologists will generally prescribe biologic drugs like TNF inhibitors, which block certain proteins made by the immune system to reduce inflammation. Other kind of biologic drugs approved for AS target different parts of the immune system to tamp down inflammation. Exercise, especially through the help of a physical therapist, can also be key in keeping pain at bay and improving posture. Check out these daily stretches for AS that experts recommend. Thanks to new and forthcoming options for diagnosis and treatment, as patients have better prognoses than they did 10 or 20 years ago, says Dr. Kumar. Because we have better therapy and are diagnosing spondyloarthritis earlier. It's becoming less and less common to see those radiographic changes, he says. That's good because once those changes start, they're irreversible and can continue even after therapy. Please like, share, comment and subscribe this video. Thanks for watching my video.